Good afternoon, this is Dr. Mirrafati from Mira Aesthetics. I've been doing this breast augmentation and plastic surgery for over 30 years now, and obviously we have done over 8,000 breast augmentation. And over 30 years, you probably have a lot of patients from across the United States, if not the world. We have actually done surgeries as far as Brazil, China, Middle East. So I have a lot of patients that we have done breast augmentation. One of the common things that I have patient coming back to me is, how often should I change my breast implant? So I decided to do a video on this because we have patients sometimes flying in and because they gone out the night before to a restaurant and having a drink at the bar, and obviously the bartender playing as a doctor tells them, oh my God, I know so-and-so who had an augmentation done 15 years ago, didn't change the implant. The implant did this X, Y, and Z, which really nothing's documented. And then we have the patient frantically coming over here just for me to tell them what I'm going to explain to you now. So the topic of this video is, how often should we change our breast implant? Now, if you go to the FDA site and look that up, it basically says it is recommended for people who have breast implant to change the implant every 10 years. It is recommended, not necessary. So short of the answer is, and I say this all the time, so if it's not broken, don't fix it. Now, that comes with a caveat. Should we not change every implant out there? So last week I had a patient that came to me that I did her tummy tuck and BBL. She came and said, hey, you know what? I want to change my implant. It's been there for 12 years. One of the first thing I said, if it's not broken, don't fix it. However, where did you do your implant, the original implant? And she basically relayed to me that it was done before she knew me, about 12 to 15 years ago, and was done in Mexico. Now, there's nothing obviously wrong doing an implant in Mexico if it's done through a legitimate plastic surgery office. So I asked, can I see your card? And the card that she showed me, it wasn't one of the familiar or the known implant company. There are two known implant companies, and I already did a video on this. You can always check that up later. Basically, as McGann or Mentor, these are the two companies that are FDA approved for producing either silicone or saline, memory gel, or gummy bear implant. So in that situation, I did recommend, because I don't know the integrity of this implant company, we should probably change the implant, and obviously she's scheduled to get that implant changed. And I haven't gone in yet, so I don't know if the implant is intact or not. I'll probably would do another video on that, showing that implant after 12 years or 15 years, how the shell broke down, or if it did break. I don't know. If it's done, if the implant that you have inside is not from the legitimate or maybe known company, McGann or Mentor, then the question is, should we change the implant in 10 years? I would say yes, because those other implant companies probably have not tested water yet, and you don't know if it's going to stay intact. But if it's done by Mentor, I use Mentor implant, and there's nothing wrong with McGann. I explained that in my other video. I just use Mentor because it's the only company that is FDA approved, and they're made right here in the United States. That's the reason. They're owned by Johnson. They have a fantastic insurance if something does get hard, or if it does break down in an automobile accident. And so that's the reason I use Mentor implant particularly. But I guess both Mentor and McGann are fine. And that 10 years is truly a recommended time period. So just don't rush to a doctor. It's more money for us to make, honestly. So patient comes in and frantic, it's been 12, 15 years. I just saw about a month ago, I would say, a patient of mine that I've done her surgery 25 years ago. There's nothing wrong with this. I mean, the implant was fine, it's sitting, the position was great. There is nothing wrong with the implant. So therefore, it's not necessary to change that implant. And it was Mentor implant as well. Now, the old Dow Corning implant, because that 25 years that I said I put a saline, back then it was Dow Corning implant. The old Dow Corning implant, which is no longer around, the old silicone implant, those of you guys who are older than maybe 50, you would remember there was a Dow Corning implant that went out of business. That it was a really good implant, but the shell of it wasn't that strong. And more often than not, the shell will break and the silicone will be all over, and it wasn't really good to have what we call the silicosis in your body. So I'm showing an intact implant, showing why, even though, and this one in a prior video, you've probably seen me cutting it. You can see that I purposely cut this implant, and as if you had a tear in implant. You can see how the silicone is staying together, is not dropping. So this is what we call the memory gel implant. It's a memory gel because even though the shell is broken, the silicone staying together. So that's the reason these implants are really known and good for. The old Dow Corning implant wasn't like that. Once the shell broke, the silicone sort of just dripped down. It was the syntoscope or the viscosity of the silicone was not strong enough to hold it together. So in the Dow Corning implant, if you done implant more than 17, 18 years ago and it was silicone, you probably have to change those implants. If it was saline implant, leave it alone. There's nothing wrong with it. Saline implant is saline, it's just a salt water. So short of the answer is, if you have done implant, if it's the old Dow Corning silicone implant, change it, because they haven't been around. It's been more than probably 17, 18 years. So if it's still there, get it out, get one of the new implant in there. If it's saline implant from Mentor and McGann, if it's not broken, don't fix it. If it's in an implant company other than Mentor and McGann, I would recommend you changing them every 10 years, just like the FDA guideline states that you should do. But if there's saline, memory gel, or the gummy bear implant for Mentor and McGann that basically started going on in the last 15, 16 years, there is no reason to change it. In my opinion, if it's not broken, don't fix it. If it's not broken, don't fix it. Let me know how you like the video and stay healthy.